Okay, so let's look at the patient journey, because this is a totally different experience for our patients. It's different enough for us as doctors to wrap our head around this. For patients, it's actually a lot more intuitive, and they really love it. So we start this journey at the new patient call, and we tell patients right away, thank you for calling, and we want to tell you a little bit about our office. And we mention the things that we offer, whether that's light force braces, or Invisalign, or dental monitoring, and all these great things we have. But we spend a little bit of time going over how this is a different technology, how we're able to provide these virtual house calls, that we're able to give them guidance every step of the way, that it will serve as the communication platform, and they're going to miss much less time away from work, school, and life. So we want them to understand that this is part of our practice, it's part of our patient experience, and we use it to help to differentiate ourselves from still a lot of doctors obviously not engaging on this platform yet. Okay, so when they come in for their consult, and we do advise them to bring their smartphone to their consult, because we're going to ask them at the consult to download the app so they're ready to go for their start visit. And if you want to take a screenshot of this, this is just a little, it's a good conversation. And I won't read it out, you can just read it later. But one of the things that I say to my patients at the consult is I say, you know, I would love to see you every week, because I kind of know that the quality of my treatment, whether this is braces or Invisalign, the quality of my treatment will be better if I could see you like all the time. I said, but that's really not practical for you to come here every week. I practice in a big city, there's traffic, I mean, not now, but usually. And I said, it's also really not practical for me to make house calls and kind of jump down your chimney every week and take a look at your teeth. But I would really love to, because I know that if I did that, your treatment would be faster, we would catch issues as they came up, I could guide you, I could be a better doctor to you. I said, I can't do it physically, but I can do it virtually. And the way that we do that is by using this app. And I promise you that if you use the app consistently and you scan as we ask you to do, your treatment will finish on time, or maybe even ahead of time. And you will just have this great support system. And so we build this into the value of our treatment plans. So going forward now, to like the end of that visit, maybe they've now already decided that they're going to start treatment in our office. So we then show them a little bit more details of the scan box and the app. We kind of guide them through the download and activation of it, and kind of continue the positive messaging. That DM is, I always tell them that DM, out of all the things that we talked about, dental monitoring is the most important thing. Whether you choose this braces or that braces or this aligner or that, the core of your experience is going to be our ability to be the best doctor that I can be, and to be the best team that we can be, and make sure you're supported all the way through. Now, at the start visit, chair side, we're going to, first of all, set the expectations of what we want them to do with it and how we want them to do it based on their unique protocol. We are going to reiterate the patient benefits, because it might have been already a few weeks or months since they first came in for their consult, and we want them to remember all those things that we talked about. And of course, we train them on the scan box in the office, and that's whether it's braces or aligners. And we are going to encourage the patient, obviously, to just follow it carefully, use it as a communication device. As I said before, a DM app is a tremendous communication device, and we're going to encourage them to ask any questions they have. I always tell the patient, don't call the office, don't text the office, even though we have the ability to do so with Weave. If you have any clinical questions, use the app. If you have an administrative question or scheduling question, feel free to call the office. But anything about your treatment, contact the app. And Marjorie, who is our dental monitoring coordinator and who's amazing and has years of experience working in my office, she'll get back to you and she'll answer. If she doesn't know, she'll send me the message and we'll figure this out. Okay, we don't set a future appointment, by the way, because every patient is put on an AOD system, appointment on demand. They're just indicated on their third to last aligner that we give them to call our office for their visit. Okay, now we're seeing a train track here, because this is the analogy. And if you remember one thing from this entire webinar, it should be this slide, because this is the analogy that I use for patients when I introduce them and talk to them at their start visit about dental monitoring. I tell them that this treatment is going to be a journey. And our goal is to get you from the start of that journey to the end of the journey in the most direct fashion. And what this analogy does of the train track is that it uses this analogy of their patient journey and their treatment journey. It also incorporates the tracking of aligners. Okay, it might not be the same with braces, but we use now LightForce braces with a digital braces system. So we do have the software up and we show them where we want them to go. And dental monitoring really kind of meshes well with all these digital systems, to be able to show them that there is an endpoint. There is a custom endpoint for you, whether that's Invisalign, whether it's LightForce, whatever it is. Dental monitoring is going to support you to get you to the doctor's prescribed custom endpoint, and that's part of the whole story of digital braces and aligners and customization. But that's a side point. Basically, we want them to keep them on track. And what I tell them is that now speaking to aligners is that every time the train starts to veer off track a little bit, the app is going to catch that. We're going to give you some extra time and we're going to snap you back on track. So there may be times that you veer, but we're always going to move you back on track so you stay on the most straight path to the end of your journey and get there in the fastest time. And don't worry about spending a few extra days, because even though you might slow down a little bit, at least you're on the right path and you're going to end up in the right place. So that's kind of the analogy that we use. And I invite you to take that analogy, make it better, kind of run with it. But for us, it really just, you see the patients, it clicks and that light goes off for them. So, okay, the next step of their patient journey is at home when they start to scan. It only takes a few minutes. When they get good, probably less than 2 minutes. They're going to follow then all the instructions and alerts that they get in the hours after that scan, after the scan has been processed by the AI. And of course, we're encouraging them based on the feedback or whatever we're giving them, ask questions, any challenges they're experiencing, and to celebrate their successes with us, because patients do, and they really love the system. Okay, so when we have a patient come in for an office visit, there's no surprises, by the way. And this is for Invisalign or for braces. There just are no surprises anymore. We're never going to have a patient who comes in. It's like, oh, we didn't know there was a broken bracket. Or, oh, shoot, they're not tracking. We have to do a refinement. We know what's happening on a granular level every week of treatment. And just having that, if you kind of stop and think, like, if you had that information as a doctor, how would that change the way you practice? And that's really the challenge of dental monitoring. And of course, these office visits are only when necessary to physically do something. But at these office visits, I always make sure we have 2 screens in our office. One is like behind the patient that we work on, and then one is in front of the patient so they can see their images, etc. So we put the dental monitoring chart up there because I want them to see that we are looking at it. And I want them to see that those scans just don't go somewhere into the ether, but they are coming into our dashboard and that we're evaluating and looking at it so that all of the work that they're doing on their end is really worth it. For refinement, people ask me, what do you do during refinement? You put a pause or a stop on the scanning, and then when they start their new aligners, you restart that. Okay, now the cool thing about dental monitoring is that it can actually flow all the way into retention. So you don't have to stop at the end of treatment. You can just create a retention protocol, which dental monitoring has some preset protocols you can use. And think about what you could do. Like, I don't know about you guys, but retainer checks are really, they take up a lot of time in our schedule, and they seem short and easy, and the patient's always like, oh, that's it? Like, I sat down in the chair, good, retainers fit, good. So imagine if you were using dental monitoring for your retainer checks, okay? And you had a system where a patient scanned maybe every month or every quarter or whatever it is. And the AI can actually measure and actually show you graphically as well if it's flat, and there hasn't been any movement of teeth, or whether teeth are starting to move. and it can alert you. So you don't even need to go in every month or quarter and look at those scans. You would simply get an alert when the patient's teeth start to move, but right away when they start to move, not a year later or 2 years later, and then they want you to do the retreatment or retreatment for free. You can know about that right away. And a lot of people are using these concepts as well to develop systems to monetize retention. And so, you know, there's also ways, of course, that you can use this to not kind of not punish patients, but to, like, you know, find out about the bad things that happen. But when a patient is doing really well and their teeth are staying stable, it's a way for you to give them good feedback and to build value into the retention protocols. So again, this is a system going all the way from that new patient phone call all the way into retention.